I'm from Australia in a small country town called Mildura. It's about 500 kilometres north from Melbourne. The approach of the surgery undertaken here at St Luke's was minimally invasive through the side in between two ribs of my left side. So back in my home country, this condition was not entirely recognised by a lot of physicians. So we found it hard just day to day getting tests and more tests to try and find out what was going on and what was causing my symptoms. So back in my home country, we struggled finding appropriate treatment and also just the timeliness of getting scans, etc., to find out what was causing my symptoms. After we had found out about the condition, we'd done some research of our own where we found a few patients that had previously been treated here in Thessaloniki from Professor Kofidis with a lot of success, and also done minimally invasive, which we liked the option of.
I'm from the UK, place just outside of Nottingham. Minimally invasive, through the ribs there, so cut there, then they went through there. That was done, yeah. I've been living with this condition probably for, symptomatically, probably 13 years. Probably a little bit longer if I thought back, but they were just mild symptoms. But after 13 years in the UK of trying to get an answer and get the angiogram done, I had some CTs done where they missed the condition. In July this year I finally had an angiogram which is showing the bridge. So I then went to London for specific testing on the bridge to see if this could be the cause of the symptoms, and they thought that it could be. So I joined a group of people from around the world with this condition.
The advantages of minimally invasive heart surgery are multifold. The first and foremost is that patients can recover and go home earlier. Beyond that, the following recovery is much faster and better, so the patients stay mobile. They return to their normal functions much faster. In many cases experience less pain, simply because the trauma of the surgery is far less. They can sleep on the side, not only on their back. They can carry weights, they can drive, they can swim, and pursue all kinds of normal activities that they had before, faster compared to a patient who has undergone median sternotomy. On top of that, in our extensive experience with minimal invasive heart surgery, these patients suffer almost no infections, they lose very little blood during the surgery. So altogether is a much more atraumatic surgery.
So I joined a group of people from around the world with this condition, read a lot and heard about Dr. Kofidis, the professor. I was in a lot of pain, so I didn't have a lot of time. And UK surgeons it's not really done a lot. It's not done a lot. There's not many, and they don't do it frequently. So I want someone who had done it a frequent amount of times, who was specifically good at that procedure. So I contacted him via Messenger, and he just got back in contact. We had a FaceTime and a talk, and he discussed with me the condition and the things he could help with. And that was it. And I basically just I booked in. I spoke to him. Spoke to the professor in, I think it was August, and came out here beginning of October. St Luke's. And it's an amazing place. Amazing facilities. The care is amazing. Very, very good.
Due to the advantages to the minimally invasive approach compared to traditional open heart surgery, it made us seek the option over here. Although be far away from Greece, we had the knowledge from Professor Kofidis and his experience with this approach, minimally invasive approach, that gave us the confidence that this would be the best way to undertake fixing my condition.
Mine and my team's experience in minimally invasive cardiac surgery goes back quite a few years. Starting out from Singapore, we have built up a world-class minimally invasive heart surgery program, and we are now transferring our expertise here in Thessaloniki at St Luke's Hospital, based on an amazing team, amazing staff, and resources which facilitate modern heart surgery. I know St Luke's Hospital for quite a few years, And I can say that I believe it's one of Greece's best healthcare providers, best hospitals, with very advanced resources. But most importantly, what I believe is very important is a familial environment. Amazing stuff of people who really care, displaying the appropriate values of patient care. All in all, I think St. Luke's Hospital provides a beautiful ecosystem to conduct advanced heart surgery.
The entire team at St. Luke's have been magnificent. The view, my room, the food, and the surgical team themselves have just been magnificent. Very friendly, very accommodating, and very timely and efficient. Going into the surgery prior, the surgical team, Professor Kofidis, kept us well informed of everything that could happen, couldn't happen, and he let us know the risk and the risk mitigation that they would take to ensure that nothing bad would happen. Thankfully, with his experience, nothing did happen, and I've come out the other end beautifully. The food, the rest of the team here, the nurses, they've been by my side daily, checking my vital conditions of my body, making sure my heart's still functioning adequately, and it's been a great experience.
I came here on the Thursday for the tests, and within 1 hour I'd had ECG, echo, CT scan and spoke to a doctor within 1 hour. In the UK, those particular tests could take you a year and a half.
St. Luke's Hospital is flexing its international muscle, so to speak, is developing capacities to welcome patients from all over the world. And my team and I are delighted to be part of this. Thessaloniki, with its culture, beauty, and history, along with advanced clinical services, can certainly be a major surgical hub in the region.
It's been amazing to stay as far as coming to hospital for heart surgery. Yeah, the professor is an amazing human being. To contact somebody on social media, it's always a bit of a daunting process. But I think him doing that, going social media, opens a massive space for so many people. Where other surgeons maybe wouldn't do that. You would have to go through secretaries and things like that. So him being able to directly speak to him, it's a big thing. And I think you need to find a surgeon who does this a lot. Obviously America have their centre. Obviously in Europe there is nowhere that's really centred for this specific operation or massive knowledge. And obviously the professor has big knowledge of this, and doing this procedure, he's done it multiple times. So I really came here for the professor, and the hospital was amazing from the minute I got here. Look after you, make sure you're okay. I thought the language barrier would be quite hard, but a lot of them speak English, a lot of them are very good. Some amazing staff, and yeah, I've been treated really good.
I've been very happy with my choice of coming here to Thessaloniki, and just the whole culture prior coming into surgery, having a look. It was just amazing getting to see the city, getting that time to check it out, and then arriving to the hospital, it exceeded my expectations. I would recommend it to anybody that is willing to look for this approach, especially with a condition that is treatable with minimally invasive heart surgery.